Sat Sri Akal, Namaskar, Adab, and welcome to the second half of my show. I hope you watched the first half. If you missed, then you really religiously need to start watching my shows every Monday, where I bring you a whole host of ideas of your well-being. I do 10 therapies in my clinic. My clinics are based in Ivor, in Birmingham, in Bradford, Edinburgh, and Glasgow. Will be a new setup starting my Glasgow trip, a marathon run I'll be doing from the 11th to the 15th of August. So first come, first serve basis, and it has to be prior booking. Will not be taken lastminute.com. And the settings are at G3 in Glasgow, near the Berkeley Street Gurdwara and the Singh Sabha Gurdwara, both those Gurdwaras. So that will be from the 11th to the 15th of August, and I then return back to Birmingham Clinic. Then don't say, oh ho, tusi ta aisi san pata hi nahi laga. Pass the word around to your nears and dears. I will be connecting with the Gurdwara as well, and they were very happily accepting public demand of me coming there because there's a huge outcry of health. Alternative medicine that jitte aapa zikr karde ne compared to the orthodox medicine, here comes in four things that I'm breaking up. The first comes in the health, whereas in complementary medicine with drugs that have been given in orthodox medicine, I aim to do an organ detox and obviously to de-stress the person. Looking at alternative medicine, I balance the opposing forces, both external and internal. External could be your moods, could be a depression feeling, could be a suppressed feeling, could be a loss of hope, could be a weepiness, it could be blockages, could be lack of love, it could be depression, hidden things, it could be panic, it could be anxiety. All these things become, external forces become blockers. Your children could be blocking your energy from healing. All these things are looked at on a broad spectrum, and it's like sieving out all the muck from your body and getting you onto a better, healthier state. So those are things. Then I look at the disease that is manifesting with complementary medicine. As a practitioner, I see the specific area that the disease is manifesting, where it's locally defined, whether it's skin, psoriasis, eczema, hay fever. It could be fungus, bacteria, it could be any other internal failure of organs, and where I help to prevent the organ going into further stress, reduce the tissue, organic stress on the tissue, and emotional traumas that are causing these blockages. Every organ has got living cells, folks. There are 600 trillion cells in your body. You may be sleeping, but through the night, your body is churning away, is regenerating, and every organ is being given new cells. Where organs fail to revive and regenerate good cells and have good oxyhemoglobin and good hemoglobin, those are the organs that will start failing, and those organs lead on to maybe the pathological blood test reports come in much later. This is where NAS can actually find out things that are there weeks, years, or years to ahead. And people say, how did it know that I've got ear imbalance? I didn't even tick it. Yes, they have a balance. How did it know that I'm seeing foggy? Because the NAS scan picked up your electrical deficiencies, and the way the body is reading the human quantum body field. Spare a moment one day and read a book on that, or go onto my website on vitality&rejuvenation.co.uk. I've spent a lot of time on human quantum body field, and you'll be quite shocked, and looking at colon hydrotherapy. One of the biggest problems that people have in digestion, again, I'll be looking at that towards the end of my show. And then looking at the stress signs and the stress on the body, such as the body language that indicates to me how the person is affected by the disruptive forces, and what I can do to reconstruct and restore the body back to a healing process. Diagnosis jehde mere hage jehde ke regularly apa medication stresses te karde ne. Morphologically, I look at the classification basis on location, at the etiology, at the alternative medicine, to consider the products and that will going to be helping the organ to become functional and diagnostically useful is the information that I pick up from my patient. Obviously, the NAS SIRA and the NAS human quantum body field comes into this, comes in acupunction, massaging, regular lymphatic massaging, having the right Ayurveda remedies, flower remedies, amazing. They do you a wonderful cleansing program. Obviously, therapies that I also do are on the therapeutic level with complementary medicine is always trying to find out what is destroying and suppressing and sickening forces jehde hunde ne that have been probably done, and it's compromised the function of the organ through radiotherapy, chemotherapy, surgery, and drug intervention. Some drugs are great, antibiotics are saviors, painkillers can give you a temporary relief but not a permanent one, anti-inflammatories can be good at a certain level, but known fact that the television program jehda vi aapa karde ne, a week later or the day after or the following 2 weeks later comes a major program on morning shows, and I'm wondering, are they listening to us? I've always just had a quiet smile to myself and said, oh my God, I've just done this show, it's been aired already. How do they use the same kind of opening formats of my show? Never mind. I guess, you know, they are listening to it and listening that Asian community at large has got some valuable programs. Taking you on to my caller who's coming into the show, and I'm going to welcome them and let's see what they have to say. Hello caller ji, sat sri akal and niga swagat thada mere program de vich.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਜੀ
ਸਾਡਾ ਪ੍ਰੋਗਰਾਮ ਅੱਜ ਹੈਗਾ ਦੇਸੀ ਟ੍ਰੀਟਮੈਂਟ ਜਿਹੜੀਆਂ ਆਪਾਂ ਕਰਦੇ ਹਾਂ ਕੰਪੇਅਰ ਟੂ ਡਾਕਟਰੀ ਟ੍ਰੀਟਮੈਂਟਾਂ। ਤੁਸੀਂ ਕੀ ਅੱਜ ਦੇ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ ਚਾਨਣਾ ਪਾਉਣਾ ਚਾਹੁੰਦੇ ਹੋ?
ਮੈਂ ਇਹ ਕਹਿੰਦੀ ਕਿ ਤੁਹਾਡਾ ਜਿਹੜਾ ਨੈਟ ਸਕੈਨ ਕਰਦੇ ਆ ਤੁਸੀਂ ਉਹ ਬਹੁਤ ਵਧੀਆ ਆ, ਉਹਦੇ ਨਾਲ ਪਤਾ ਲੱਗ ਜਾਂਦਾ ਸਾਰਾ ਕੁਝ ਕਿ ਤੁਹਾਡੀ ਬੋਡੀ 'ਚ ਕੀ ਰੋਂਗ ਹੈਗਾ ਉਹਦੇ ਨਾਲ। ਤਾਂ ਮੈਂ ਆਪਣੀ ਜੀਪੀ ਦੇ 2 ਸਾਲ ਪਹਿਲਾਂ ਜਾਂਦੀ ਰਹੀ ਹਾਂ, ਪਰ ਮੇਰੇ ਜੀਪੀ ਨੂੰ ਕੁਝ ਸਮਝ ਨਹੀਂ ਆਇਆ। ਉਹ ਹਮੇਸ਼ਾ ਕਹਿੰਦਾ ਹੁੰਦਾ ਸੀ ਤੈਨੂੰ ਡਿਪਰੈਸ਼ਨ ਆ, ਤੈਨੂੰ ਡਿਪਰੈਸ਼ਨ ਆ, ਬਸ ਉਹਦੀ ਦਵਾਈ ਦਿੰਦਾ ਰਹਿੰਦਾ ਸੀ। ਪਰ ਮੈਂ ਕਦੇ ਉੱਤੇ ਬਿਲੀਵ ਨਹੀਂ ਕੀਤਾ, ਪਰ ਮੈਨੂੰ ਪਤਾ ਸੀ ਕਿ ਮੈਨੂੰ ਡਿਪਰੈਸ਼ਨ ਨਹੀਂ ਹੈਗਾ, ਕੁਝ ਹੋ ਰਿਹਾ। ਤੇ ਇਸ ਕਰਕੇ ਫਿਰ ਮੈਂ ਤੁਹਾਨੂੰ ਟੀਵੀ ਤੇ ਦੇਖਿਆ, ਤੁਹਾਡੇ ਕੋਲ ਗਈ, ਤੁਸੀਂ ਮੈਨੂੰ ਬਹੁਤ ਵਧੀਆ ਟ੍ਰੀਟਮੈਂਟ ਦਿੱਤੀ। ਮੈਂ ਤੁਹਾਡੇ ਚਿਲ ਡ੍ਰੌਪਸ ਜਿਹੜੇ ਆ ਮੈਨੂੰ ਬਹੁਤ ਜ਼ਿਆਦਾ ਹੈਲਪ ਹੋਏ।
ਮਾਈ ਫੇਵਰਿਟ ਟੂ।
ਮੇਰਾ ਨਰਵਸ ਸਿਸਟਮ ਇੰਨਾ ਜ਼ਿਆਦਾ ਖਰਾਬ ਸੀਗਾ ਕਿ ਮੈਨੂੰ ਆਪਣਾ ਕੰਮ ਵੀ ਕਰਨਾ ਪਿਆ, ਤੇ ਉਹ ਬਸ ਡਿਪਰੈਸ਼ਨ ਦੀ ਗੋਲੀ ਦੇ ਜਾਂਦੇ ਸੀ, ਪਰ ਮੈਨੂੰ ਉਹਦੇ ਨਾਲ ਇੰਨਾ ਗੈਸਟ੍ਰਿਕ ਹੁੰਦਾ ਸੀਗਾ, ਮੈਨੂੰ ਡਿਜ਼ੀਨੈਸ ਫੀਲ ਹੁੰਦਾ ਸੀਗਾ, ਤੇ ਮੈਨੂੰ ਬਹੁਤ ਕੁਝ ਹੁੰਦਾ ਸੀ। ਮੇਰਾ ਬੈਲੈਂਸ ਵੀ ਠੀਕ ਨਹੀਂ ਸੀਗਾ, ਬਲੋਟਿੰਗ ਹੁੰਦੀ ਸੀ, ਬਸ ਸਾਰਾ ਕੁਝ ਮੈਨੂੰ ਉਹ ਜਦੋਂ ਹੁੰਦਾ ਸੀ ਉਹਦੇ ਨਾਲ ਹੀ ਮੈਨੂੰ ਨਰਵਸ ਹੋ ਜਾਂਦੀ ਸੀ ਕਿ ਮੈਨੂੰ ਕੀ ਹੋ ਰਿਹਾ ਹੈ, ਕਾਹਦੇ ਹੋ ਰਿਹਾ, ਮੈਨੂੰ
ਪੈਨਿਕ ਅਟੈਕ ਵਾਂਗਰ ਹੈ ਨਾ।
ਹਾਂਜੀ ਜੀ, ਉਹ ਸੋਚ ਕੇ ਮੈਨੂੰ ਨਰਵਸ ਸਿਸਟਮ ਮੇਰਾ ਹੋ ਜਾਂਦਾ ਸੀਗਾ ਜੀ। ਤੇ ਹੁਣ ਤੁਸੀਂ ਜਿਹੜੇ ਚਿਲ ਡ੍ਰੌਪਸ ਦਿੱਤੇ ਆ ਉਹਦੇ ਨਾਲ ਮੈਨੂੰ ਬਹੁਤ ਜ਼ਿਆਦਾ ਫਰਕ ਪਿਆ। ਤੇ ਜਿਹੜਾ ਤੁਸੀਂ ਮੇਰਾ ਕੋਲਨ ਕੀਤਾ ਆ ਡੀਟੌਕਸ, ਉਹਦੇ ਨਾਲ ਬਹੁਤ ਜ਼ਿਆਦਾ ਫਰਕ ਪਿਆ ਮੈਨੂੰ, ਹਾਈਡਰੋਥੈਰੇਪੀ। ਹਾਂਜੀ, ਤੇ ਮੈਨੂੰ ਗੈਸਟ੍ਰਿਕ ਤੋਂ ਵੀ ਕਾਫੀ ਜ਼ਿਆਦਾ ਫਰਕ ਆ, ਪਰ ਹੱਲੇ ਮੈਨੂੰ ਲੱਗਦਾ ਹੋਰ 2 ਮਹੀਨੇ ਮੈਨੂੰ ਦਵਾਈ ਖਾਣੀ ਪਏਗੀ, ਫਿਰ ਉਸ ਤੋਂ ਬਾਅਦ ਚ ਮੈਂ ਬਿਲਕੁਲ ਠੀਕ ਹੋ ਜਾਵਾਂਗੀ। ਜਦੋਂ ਤੁਹਾਡੀ ਦਵਾਈ ਖਾਂਦੀ ਆ, ਮੈਂ ਬਾਹਰ ਜਾਂਦੀ ਆ, ਮੈਂ ਆਪਣੇ ਕੰਮ ਆਪ ਕਰਦੀ, ਨਹੀਂ ਤਾਂ ਮੈਂ ਜਾ ਨਹੀਂ ਸੀ ਸਕਦੀ।
ਵਾਹ ਜੀ ਵਾਹ। ਹੁਣ ਕੰਮ ਤੇ ਜਾ ਰਹੇ ਹੋ?
ਹਾਂਜੀ, ਮੈਂ ਹੁਣ ਪਾਰਟ ਟਾਈਮ ਸ਼ੁਰੂ ਕੀਤਾ।
ਸੋ ਨਾਈਸ। ਜਿੱਥੇ ਕੰਮ ਛੁੱਟ ਗਿਆ ਸੀ 2 ਸਾਲ, ਤੁਸੀਂ ਡਾਕਟਰਾਂ ਦੀ ਬਹੁਤ ਜ਼ਿਆਦਾ ਦਰਵਾਜ਼ੇ ਖੜਕਾਈ, ਯੂ ਆਰ ਨਾਟ ਗੈਟਿੰਗ ਆਨਸਰਸ। ਦੇयर वर so many things that we managed to find out, and one of the most fascinating things we found out was the blue light syndrome of the television.
ਹਾਂਜੀ, ਉਹ ਬਹੁਤ ਜ਼ਿਆਦਾ ਮੈਨੂੰ ਪ੍ਰੋਬਲਮ ਸੀ। ਮੇਰਾ ਸਾਰਾ ਦਿਨ ਕੰਮ ਜਿਹੜਾ ਕੰਪਿਊਟਰ ਤੇ ਆ ਕੰਮ ਤੇ।
Yeah, and that was really affecting you, and you were fogging out and having massive dizzy spells and balance.
That was the main reason. That was the main reason is affecting me more.
And you had to give up your job because of the blue light syndrome. And I managed to find out the reason, and within a week you came back with amazing results, and the second colonic hydrotherapy was amazing, and you've just become such a different person. And your whole aura has changed with diet, lifestyle. What do you think about the pinniya, Penji?
ਹਾਂ, ਪਿੰਨੀਆਂ ਤਾਂ ਬਹੁਤ ਹੀ ਵਧੀਆ ਤੁਹਾਡੇ, ਉਹ ਤਾਂ ਕੋਈ ਉਹਦੀ ਕੰਪੇਅਰ ਹੀ ਨਹੀਂ ਕਰ ਸਕਦਾ।
It's amazing superfood. I hope you take it to work.
Yeah, amazing things.
Yeah. People think what they watch. People think what they watched on my first launch over 5-6 years ago is the pinya. today, which her mother gave the gold bracelet and bought a handbag.
My God.
So Bibia nu ਕਹਿੰਦੀ ਹੈ, don't lavish your children with gold, 16th birthday, the 21st birthday, because you don't know where they're going to be spending this money. And gold is easily sold these days, and people buy gold at any other corner shops nowadays and give you cash back. But they don't value, and I was shocked at the amount of alcohol our young girls are drinking. I'm shocked that until they don't have 6 shots of vodka, they cannot move. I was just shocked of what I saw, honestly. And it gives me more and more light of ਇਹ ਕੁੜੀਆਂ ਦਾ ਹਾਲ 10 ਸਾਲਾਂ ਦੇ ਵਿੱਚ ਕੀ ਹੋਏਗਾ, ਰੱਬ ਜਾਣੇ.
ਅੱਛਾ ਜੀ, ਮੈਂ ਫੋਨ ਰੱਖਦੀ ਹਾਂ ਨਾ.
ਹਾਂਜੀ. Okay ਜੀ, ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, bye-bye. So this is a caller ਜਿਹੜਾ ਕਿ ਸਾਨੂੰ feedback ਦਿੱਤਾ about the chill drops and her nervousness, her blue light syndrome, her dizziness, her constipation, the gas, the bloatedness, the depression, and classically 2 years doctoran de takke kha ke of saying you've got depression is the mind. She gave up her job. She's now back to work after the first month and dressing up and having that feel good factor, because you sit at home and you wear the same shaggy clothes and you don't have that feeling of wellness or of mental pickup and the perkiness that you need. And this lady, same, who's speaking to me, who got lost on the first day, they're sidetracked and went 7 miles off course from the navigation, came back, and I thought, oh, I don't think she's going to book again. But please, time or for one time, I am very much GMT time, not Indian last stretch time. Jida time ditta 10 minute pello aao, and then respect my time and space. Do not argue for late attendance. I don't take any late attendances, and me traveling from here to Glasgow to Birmingham, touch wood, badi kirpa Vaheguru di, never been late. Whether I leave at 2 a.m. or 3 a.m. is my prerogative to serve the community. Your prerogative to come at the time that's been given to you, because it's all dictated to your therapies and also who's coming after you. So please, Glasgow wale ne patients I'll be in Glasgow from the 10th of August, and my clinics will be running till the 15th of August in code G3 at the 2 gurdwaras आसपास ਜਿਹੜੇ ਹੈਗੇ ਨੇ ਥੋੜੇ mileage which. Do not ring at the last minute to find a spot and regret, because window shopping ਕਰਦੇ ਲੋਕੀ ਕਿ ਭੈਣੇ ਤੈਨੂੰ ਫਰਕ ਪਿਆ. And this is the first thing that they do even in Birmingham. Patients sitting there when she has chronic panic attacks, and asked my patient who had severe colitis, who had nothing but a removal of colon, ਤੇ doctors ਕਹਿ ਰਹੇ ਸੀਗੇ ਕਿ ਆਹ ਇੱਥੇ ਸਾਈਨ ਕਰ ਦੇ ਕਿ ਤੇਰੇ colon ਦਾ ਪਾਈਪ ਕੱਢ ਕੇ we'll put on a new bag, stoma bag. She left the hospital under an excuse, came to me. To the way the sun rays are. How clever were the Romans at that time who created time, and also then came in maths, and then came in water therapies from the Romans, and the Roman baths, and all these things were created for therapies, not just to soak up and have good skin. So things that were already done traditionally were there already. So then going on to obviously therapies before we had our call. Thank you so much, Caller-ji. And then obviously looking at why alternative medicine why is 53% people knocking on alternative practitioners' doors? Because they've lost hope and faith and helplessness, and they're seeking alternative cheeza. Obviously, in my therapy, what I do is to strengthen the well-being and the health, promoting the tissues to regenerate. Obviously, this depends on how much time has been lost in the demise of those organs and how much time it's going to take me. But don't ask me in the first meeting for cirrhosis of kidneys or cellulitis or weight problems, how long will it be before I see results? How long will it be before you change this mind, before you change your lifestyle, before you change your diet, before you change your cooking habits, and before Bibia get rid of the vegetable oil? And changing the household ladies' shopping habits is my biggest mission through cook shows. And I think I've managed to help them. But a lot of them still have a small vision to say, oh, 10 kilo da tail pya onu fish kar lene. They still have a vision of refrying and putting the oil back into the oven and getting it out and refrying and getting it out. Seriously, women have to be the culprits and probably the one force that is destroying men's health, unless the men themselves dictate to the woman what they want for their well-being. Obviously, when the disease is manifesting for so many years, there is so much trauma and stress in those organs that I have to clean up like a Hoover suction and then put you back onto a cellular, molecular, physical, physiological, psychological level before your body starts resonating positive healing signals. Starts from the mind again. If this mind is shakky and vemmy and you don't think it's going to move, then nothing is going to move. So all these things come in force. Pharmaceutical obviously can be a lifesaver, but it's also demonstrating deviation of, or a malfunction of function of structured organs, and a lot of the X-rays, bloods, MRI scans, which are sometimes giving us information, but sometimes not always very clear onto what is happening molecularly within the body. Holistic approach, my side, it's labeled holistic, and I stress on the total holistic therapies that I do, because I thought one was not enough. I carried on 2, 3, 4, and my mother was saying, Pata, when are you going to stop studying? And my brother says, Mom, why are you putting her off? We can't do what she's doing, so let her study. And many times I've had to put my business aside and promote my studying forefront. And now doing lecturing at Regents universities for students is so much passion just to pass away, but on such a higher level than what I'm doing here. Obviously, that is so demographically different because I'm addressing structurally what's happening within the body. Obviously, with my years of education and qualifications, and I have risen to a point of learning how to look at our communities, diet, juicing therapies, lifestyle patterns, foods, and that comes the cook shows in, and how these diseases which are manifesting, and how to get you back onto a natural healing process, how to restore, how to balance, how to naturally treat the body. And all this is so complex. Little do you know that this is not just 1 week's work. Obviously, viewing the disease on a sympathetic way and underlining all the symptomatic reasons and what is happening within the organs and what is malfunctioning. In my clinical practice, obviously with the experience and with the aims, my aim is to guide my patient and practice limiting the biomedical approach is what my aim is. Obviously, intervention physiologically and specially on various issues which will come in would be the social factors, will be the spiritual love. We are all thought to be quite relevant and important on this earth, but do we have our self-care as our prerogative, or do we have to look at our friends' cars and their iPhone and the kind of shoes they're wearing, but maybe they're not very healthy in their body? So materialistic world is what we are living in. People seem not to pay their debts. And I told a young Sikh boy off yesterday, having found out that he's doing these projects, you know, trying to raise the levels of Sikhi. and doing different kinds of functions, but does not pay his caterers, the trophy payers, and I had to put him on a straight line yesterday. Ke Sikhi da Siddhant hai always to be honest, truthful, and being very trusting to the community, but do not misuse and bluff people. And that's where then the Sardar di Dastar de upar kalank lag raha hai. Obviously, very much on natural and effective and preventative through diet, reducing the stress, as my patient called very graciously, need to thank her. Environmental stresses, which are the change to the patient, which cause and are the active role to your health, because if you do not look at the environmental stresses of the body, then I feel that the message is not going across to the body. Indian Hakims, obviously, a lot of doctors are looking at it that they are not executing the products properly, and they have a bad name, but we have credibility of getting analytic proofs of our herbs and filtrations that we do. All my filtrations, even to the most sensitive patient who called Panji, has not reacted with heartburns or indigestions and symptoms that people come to you all to do with serious problems. Obviously, structured program jada dinta janda at my clinic, I treat the ailments, and other than that, I support the progressive changes in the patient other than grade 3 and grade 4 cancers. Again, clinic the number hate like te hagaya based clinics in Ivor, Birmingham, Bradford probably once in 2.5 months, and Glasgow returning back after only a month out of public demand. I will be in Glasgow from the 11th, but I will be reaching there on the 10th. I may be doing a clinic on the 10th of August. But from the 11th to the 15th of August, I'll be holding a marathon clinic. So please book in advance. Holistic message, jada concern hai, how do I guide and how I can help you change your lifestyle, your work, your environment, and how these toxic fumes and dyes have affected our publics who have worked in foundries. Safety precautions were not followed, and these people today are suffering horrendously with so many side effects on their skin tissue, with psoriasis, lungs, COPD, and lung failures, which are really, some of them, irreversible. These impacts can be seriously damaging. I strongly believe that when things have manifested in your body, signs of wellness and illness come from maldigestion. They will be coming from constipation, as the caller so called. Serious problems, that is where my colon hydrotherapy comes in. Then come in all the digestive enzymes, how the stomach is imbalanced, where the biggest problems will occur, and then the funguses, bacterias, and looking at sleep disorders is a huge problem. Looking at blood flukes and human parasites is a parasitology degree that I did. It was shocking. If you ever come to my talk shows where obviously you can't come unless you're a student or registered for MSc, you'll be shocked. You'll probably want to throw up what you've eaten of what is living in human beings. Obviously, then comes in the appearance of the whole body structure, the gait, the balance, the body odor as well. Tongue funguses, horrendous. Patients obviously often have a 1-inch thick, symptoms which are on the tongue, and those are my approaches to trying to make you have better health. Look at your beliefs, your attitude, and obviously I'm sitting here not just playing marbles with people's lives, but value your life. This is one life that you have. Obviously, you're already in a shock state when you come to me. Lot of fraud babbe out there, but try to look out for yourself. This is not parting away with cash of 4,500 to 12,000. Koi part thod le kar lega, thodi bimari te depression theek ho jayega. Lots of things that I hear. I'm shocked how people psychological equilibrium is unbalanced. Obviously, orthodox aims to destroy and demolish or suppress the sickening forces, and the chemical therapies and surgery. I actually go against that, and I actually try to rebalance it. I re-emphasize on all the natural therapies I do to restore, how to strengthen and revitalize your health, and promoting the forces. The emphasis is health versus wealth. Folks, let me take you to another night at 9:40 p.m. next Monday. Again, stay tuned with the Call Channel. Dekhna na bhulna, my show with Manjeet Kaur across the globes of UK and Europe. Sat Sri Akal and a good night.